So Dr. Parker and I have been seeing a lot of consults recently for rhinoplasty, and I just wanted to talk about two of the most common things that people come in about. The first one is what everybody kind of sees in other people's noses, which is what we call dorsal hump, or the little bump at the top of your nose. And what causes that little bump is a combination of two things. One, it's your actual nasal bones in the upper part of your nose, and then part of the cartilage that makes up the lower part of your nose. And so it can be very simple, or it can be a little more complex to get rid of that little hump. The second thing that people come in for mostly is a crooked nose, and there are lots of causes to crooked noses. However, most people with a crooked nose will also say that they have trouble breathing out of one side or other of their nose. And often this means that rather than have a crooked nose from the bony part of your nose and the upper part, that septum, or the middle part of your nose that's made up of mostly cartilage, is going to be crooked, which can obstruct your breathing along with some parts inside of your nose. Now, what's important to note is that if you do have some trouble breathing, insurance will cover the septoplasty, or the changing of that middle bone portion of your procedure, okay? However, a lot of times insurance will not cover other things in rhinoplasty, such as changing the nasal tip or changing things about the nasal bones that people don't like, including dorsal humps. So if you have any questions about rhinoplasty, Dr. Parker and I would love to see you in clinic or with a virtual consult.